Welcome back to another Action News Jax Health Alert segment. February is National Cancer Prevention Month. I'm joined by Dr. Scott Ackerman from the Ackerman Cancer Center.
Good morning.
Dr. Ackerman, thanks so much for joining us again.
Thank you.
Let's talk about this because, you know, a lot of cancers are preventable, right? And people have to know about that.
Many cancers are preventable, and we've made great advances in prevention of cancer, starting from many, many years ago. You know, cigarette smoking has been related to many cancers, lung cancer, pancreatic cancer, other cancers, and we know that the prevalence of cigarette smoking has gone down greatly in the past 20, 30 years, and that's minimized the impact of lung cancer. But other lifestyle things now we're looking at, and people are living a healthier lifestyle, and you can do that and reduce your risk of certain cancers.
When it comes to cancer screening, certain cancers need to be screened, but you know, a lot of people, unfortunately, they don't get screened for one reason or another, or maybe they make an appointment and they don't show up. That's real important, right? You can't do that.
Advancements in cancer screening have made it so that we can identify cancers very early and cure them at a very high rate. But unfortunately, a lot of people don't do cancer screenings because they're afraid of what they're going to find. Women are getting their mammograms on a fairly regular basis. We've gotten the percentage of women that get their mammograms regularly to a very high number, 70, 80%. But men with prostate cancer screenings and people in general getting colon cancer screenings, those numbers aren't really where they should be. Yeah. And these are screenings that could cure cancer.
Very important. My dad passed away of colon cancer. I've had 6 screenings over a number of years. Everything turned out great, but
thank goodness.
It's important to continue to do that. Lifestyle changes versus genetics. The difference between the two, I mean, you could prevent cancer, but I mean, if it's in your family, is it still preventable?
Right, so a lot of advances have been in genomic testing and genetic testing on patients to find out what genetic defect a person might have that would put them at a higher propensity for certain cancers. Okay. And the truth is that all the lifestyle changes you make, maybe you can't change things because of your genetic makeup, and many cancers are related to genetics. But these genetic defects or that we may have make it so that you're at a higher risk for cancers. And people that have genetic defects still can do things, lifestyle, still can do things for screening to make sure that if, God forbid, they're diagnosed with cancer, it's diagnosed early.
I'm going to get one more question in, too, about cancer cures and the possibility of using AI either now or in the future to possibly find a cure maybe over the next couple of years. Are you using AI right now?
So in the cancer space, we've been using AI for quite a while, and it's exploding. So we use it for certain screenings. We use AI to help our radiologists read CAT scans and mammograms and x-rays. We've been doing that for many years, and AI can look at those scans and help radiologists find cancers that they may not normally see. AI is being used to look at pathology specimens, to identify cancers in pathology specimens, to work with the pathologist, and to model those pathology specimens and help us identify which cancers are more aggressive that might need intensification of treatment. But the real cool stuff with AI is in the research bench. Yeah. And people doing research are using AI to help identify molecules and drugs more rapidly that will be targeted for cancers. So processes that would take 2 or 3 years, now with AI, take 2 or 3 months to develop new drugs.
Such an exciting time, right?
It's so cool.
And all the hope for a cancer cure possibly soon. Dr. Ackerman, thanks so much for joining us.
Thank you, Phil.
We'll see you once again next month.